Joining us now is Dr. Vin Gupta. He's a pulmonologist and an NBC News medical contributor.
Doctor, thanks so much for being with us. Let's sort through some of the things. First of all, just terrible things going on in India. Let's sort through some of the things going on in our own country right now, a hodgepodge of openings, reopenings across the United States. We've been told that if you've been vaccinated, you can go maskless outside. When your friends call you and ask you what's safe, what's not safe, what's your general guidance to them?
Good morning, Joe. My general guidance to them is to enjoy the things that they've long wanted to do, whether it's going out to eat, whether it's going to the ballpark. I've been advising a few clubs here about safe reopenings of larger events, to do those things, but to just follow masking guidance when you're going to the concession stand, when you're closer to people where distancing is still yet not possible. But you can start to normalize your life, Joe, and which is a larger point here, that really to open up small and medium businesses. The question here is, how do we do that? How do we remove some of these onerous burdensome mitigation initiatives that have been in place for 14 months? We can't do that without some form of vaccine verification. It's impossible to continue to limit indoor capacity without having the ability to say, you know what, you're clear. No, you're not clear because you haven't gotten the vaccine. That is the quickest way to reopen. And we should be doing that more broadly. You're going to see the airline industry, the restaurant industry, probably professional sports teams move towards that path. And I think it's a smart path.
No, and also, when do we get to a point where, it's getting close now where if you want a vaccine, certainly in our state, if you want a vaccine, you can get a vaccine. At what point do we just open things up and those who don't have a vaccine and they choose not to have a vaccine have the freedom to not have that vaccine? Also, of course, have the freedom to get sick. It's just like people who...
Except they end up in our emergency rooms.
Well, just like people who smoke cigarettes. We don't go up to people and take cigarettes out of people's mouths when they're smoking cigarettes. At some point, people make choices and they have to deal with the consequences of their choices. We can't keep America closed down for those people who are too stubborn to get vaccines, can we?
Well, Joe, let me answer this way. What we don't want to do is enter a false sense of security where, say, we reach 60% coverage of the vaccine. Warmer weather, we know coronavirus doesn't like warmer weather. It likes cold, dry air. So we're going to be lulled into this false sense of security where maybe case rates remain low. We know hospitalizations are going to hopefully continue to decline, 80 to 85% capacity in most zip codes across the country. What we don't want, though, is that situation, false sense of security, because come fall, winter, that's when we can see a fourth wave across the country. So that's why it's really important that for all of you out there who are still considering getting the vaccine, I still think, Joe, most people are reachable when I talk to them, younger individuals. They just want to have a conversation. We really cannot say, well, let's put our hands up and 60% is okay. They are reachable. We just have to reach them better.
Well, and we can try to reach them better. I'm just saying, like, for instance, you talk about the fall. Every school, I think most parents would say every school better be open in the fall. When I drive past small businesses, whether it's in Washington, D.C. or Boston, and I see all these small businesses still closed, you just sit there and go, wait a second. We've got well over 100 million people with vaccines in their arms. Why can't we open up all of these places? People can wear masks. They can do social distancing. They can have ventilation in the stores. And we can stop every last small business owner from going bankrupt. I just think, we've been talking about this for a year, and I've been very conservative with a small c. Follow the science. Follow guidance. Wear your mask. Do your social distancing. I still believe the same things. I just believe at this point, we also have mental health challenges. We have huge economic challenges for small business owners. Like, at what point do we reopen this country and follow those distancing guidelines and follow those mask guidelines when you're inside a building? Mm-hmm.
Well, and I'll say in response to that, the biggest issue, Joe, to normalcy is the distancing issue. Whether it's a restaurant or whether it's a small business that's selling retail, if you have how can we quickly off-ramp distancing measures? And the quickest way to do that is actually just to either mandate the proof of a vaccination or a negative test. We need to introduce friction into the system. If you've gotten a vaccine, Restaurants, if they can verify one or the other, they can get to 100% capacity, Joe.
Hey, thanks so much for watching our YouTube channel. You can follow up on today's top stories and breaking news, or catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.